Welcome to the SCI Forum podcast. This podcast was produced by the Northwest Regional Spinal Cord Injury System in the University of Washington Department of Rehabilitation Medicine. The Northwest Regional SCI system is dedicated to improving the lives of people with SCI through excellent patient care, research, and education. To learn more about our podcasts and videos or to make a donation, go to sci.washington.edu. This podcast was taken from a live SCI forum. You can watch the video on our website or YouTube channel. Go to sci.washington.edu/videos.
This portion of our SCI Summit today really grew out of a lot of discussions, both with talking with people with spinal cord injury, as well as talking to other providers. And I think that one of the things that has come up a lot is that a lot of people feel like there's a lot to learn, which I think is totally true. I also think that a lot of people forget about how to communicate. And I think that the best way to learn is from people who have lived experience and can kind of give that information to you. So we have invited 4 fantastic people to join us today to really talk about some things about thinking about their healthcare providers, what worked, what didn't, both early after injury as well as now and in dealing with healthcare as they go. And so I'm going to let each of them just briefly introduce themselves and tell just a brief bit about their injury, when they were injured, and then we'll move into me asking them questions. And I will try to leave a decent amount of time at the end for your questions as well. So thank you all, and thanks to our panel for being here. And if it's okay, I'll start with you, Shannon, if you could introduce yourself.
My name is Jeanne Hoffman, and I was injured 2.5 years ago in March of 2015, bicycle accident, and I am a C5, C6 level injury.
My name is Don Totten. I was hurt in 81 skiing at White Pass. I'm a T5-ish, sort of start around T4, get done around T6. And I've got a son, a wife, and I work at Microsoft.
My name is Lan Remy. I was injured in 2011 in a bicycle accident. I'm a C5, C6.
And I'm Kyle Ryder. I broke my neck at C5 level just over 2 years ago in a shallow dive accident.
Thank you all for being here. The first question that I want to direct to you is really thinking about kind of that early experience with healthcare after injury. Typically, people don't have a lot of exposure until they have an injury like this. And I'm curious about kind of what your experiences were in that early aftermath. And if it's okay, I'll start with you, Kyle. Just what was your experience, and kind of talk a little bit about what was helpful and what made it easier.
So since our discussion earlier, I've thought about this a lot. And I think there's a real challenge for providers right after an injury like this, because in certain situations, or in my situation, I was heavily medicated. And so you've got the effect of the drugs making things very unclear. And at the same time, there's a desire for clarity to really fully understand what's happened to you and what the future looks like. And then on top of that, you also have a fair amount of uncertainty just to the nature of a spinal cord injury. So I think that there's a way to balance that as a provider, where you're having honest discussions in a timely manner, while at the same time understanding that you might need to repeat that conversation a couple days later, or a week later, or a couple weeks later. But it really took me, I would say, 3 months, or between 2 or 3 months before I fully comprehended the scope of my injury. I remember being in the ICU, the weeks or the first 2 weeks after my injury, imagining how I would redesign the house to have like a jungle gym, so we could swing around the room, not understanding that you could be paralyzed and lose function of your wrist and hands like I have. Just the whole scope was totally foreign. So.
I'm going to jump to you, Shannon. What about you? What was your early experience, and kind of what did you find helpful in that early time from healthcare providers?
Well, I will say I'm going to start with a challenge first, which was that I didn't have a primary care provider at the time, and I think it would have been really comforting to have a doctor to work with who I was already familiar with. So that was a big challenge, meeting new doctors and trying to develop a relationship at the same time that you are getting, somewhat devastating news that you're trying to comprehend and digest, and there's a lot of learning there that's going on too. So of course there's nothing you can do about that in advance except maybe go get a primary care doctor. But I would say another challenge, sorry to focus on challenges, I know you didn't ask for that, but was that, 1 year, and I was in Harborview, it was a teaching hospital, and, my doctors changed a couple times while I was in inpatient rehab. And that was a little startling as well. You're just developing this relationship and you're learning about your injury. And then you're like, oh, tomorrow you'll have a new team of doctors. So it's hard to figure out who to turn to if you have questions. And then, you get out of the hospital and, I've had questions with my insurance company, 2 years later, questions with my insurance company like, do I call my spinal cord injury doctor? Do I call my primary care doctor, who I don't even know very well? Do I call my urologist? Who do I call? Who's responsible for helping me, get this stuff done? And I think the answer is that you're the one responsible for it, and whichever doctor you know the best is probably going to help you. But it's all really confusing, and I don't know that I have great advice as to how to manage all that, except if you have a really go-getter family member who might want to organize it for you. But I think just the sheer quantity of information and medical providers that you work with is really overwhelming. I don't know if I answered your question at all.
That's great. Lynn, can you speak a little bit to kind of that early period during inpatient rehab? You were at Harborview as well. What are the things that were kind of really important for you in terms of thinking about kind of learning about it and really getting through that process?
Well, my therapist, my doctor, and most of my experiences with the professionals in inpatient was just really about as good as it could get. I felt like I was in good hands with people who knew what to do and knew their way around, and I myself was. It was pretty overwhelming, and I just felt like this blob. I didn't know how to do much of anything except maybe watch TV. But early on, I'd had surgery when I first arrived, and so I had some pain and was on a lot of pain medications for I think all the time I was inpatient, and that clouded a lot of things as well. But the therapists and the doctors, just by being positive and goal oriented and forward moving, just gave me lots of hope and encouragement for the most part.
And I know it's been a little while, Don.
Yeah.
But when you think back to that time, and your rehab was a very different experience than it's been in more recent years, a lot longer time.
That's what I understand, yeah.
Yeah. Did you think about, when you think back, do you think that there was things that really prepared you for how you're dealing with healthcare providers now?
That's a great question. I think maybe to start with, I was pretty young. I was 17 when I got hurt, and reasonably athletic. And so I'd been hurt in other ways quite often, actually. Pretty injury prone. And so the idea that I wasn't going to get better was pretty foreign to me. And so I think I was, it was helpful actually to go 4 or 5 months thinking I was going to get better. And then by the time I had convinced myself that I wasn't going to get better, I was kind of used to it. I don't know if that makes any sense or not. But there was that. The other thing, I think Kathy Worms, who was here, I saw earlier, was one of my rehab nurses. And they did a really nice job back then of sort of matching you up with somebody and keeping you with them forever. I mean, I think I last saw Kathy the month before she retired, right? So that kind of relationship was, I think, super helpful. And she was really good at saying, hey, this isn't a rehab problem. You need to go over there for the thing you came in for today. And that relationship was really big for me, I think.
Yeah, and I don't know that, do you guys feel like you have kind of unidentified person, or is it more of the kind of expertise? I heard the rest of you kind of talk about like your SCI team versus your non-SCI teams. Do you feel like you have people? I don't know, anybody? Kyle, do you want to respond to that?
Yeah, absolutely. And I feel, as Shannon alluded to earlier, that's really important for the patient to own their own care. And I think for most people, they need to hear that from a doctor or from someone, from a provider. And so I think that's a key component, is for the providers to coach people how to be a good patient. Because it doesn't come naturally. I think what comes naturally is for people to want to just hear definitive information from providers and have it be black and white. And it's not that way at all.
Yeah, there's very little about spinal cord injury that's just black and white. Mm-hmm. Makes it harder. I'm curious about, I had to have you all talk a little bit about kind of what helped with your kind of adjustment in that process from inpatient to outpatient. Things that your therapists and your physicians said that really helped that process be easier, and things that may have been more difficult. Starting with you, Lan, what were things that your team really were good about, and then things that were a little bit harder?
Well, I think the skills of transfer skills, also my wife was very involved in my inpatient, and she was there pretty much every day, and they encouraged her and trained her in how to take care of my basic daily needs and functions. And so that gave both of us a lot of assurance that we would be equipped for that transition to home. Even though we did know that was going to be challenging, it was very encouraging to have that training, especially for her. The staff, the therapists, and the nursing staff at Harborview worked quite a bit with her and me together to make sure that happened. Some of the other things that happened were, referrals. And of course, I should mention one of the forgotten things is recreational therapy. That was kind of a treat and unexpected pleasure. Every once in a while, this person would show up and say, "I'm your recreational therapist. Let's go to Molly Moon's." And I go, hey, wow.
Hey, they didn't take me to Molly Moon's.
Shannon's jealous.
But the recreational therapists had so many practical tips on operating an elevator, crossing a crosswalk, all kinds of practical things that just wouldn't normally come up in a medical setting. So that was huge. And one day we went to a museum in the big Harborview bus and then dropped by my house where people were working on the ramp and things to get things ready. So that was all kind of neat. The recreational therapy was especially helpful to me.
So getting out in the community a little bit. You all had that experience, correct? Yeah, and Kyle, you did your rehab at Craig Hospital in Colorado, correct?
Yep.
And they have a great rec therapy program as well, I understand. Do you want to talk a little bit about that and fitting with kind of this whole piece of getting you prepared to be out in the world?
I think what recreational therapy does really well is it shows you that it's okay to be a little bit vulnerable. And when you're, I too identify as being someone who's very independent, and to go from being fully functioning to being very dependent in an inpatient setting, you develop a level of comfort where you have providers to your left and to your right. So if you need a infectious disease doctor, they just show up the next morning to where you're living, in the hospital. And recreational therapy kind of shows you it's all right. You can go to the mall or go on a hike or go out and be far away from that core of professionals, and that's really freeing.
So on the other side of things, like there's been a lot of things, and you all had really positive experiences in preparing you. But are there people or statements or things that stand out that you kind of went, oh, that was hard, that wasn't helpful in my process? And, thinking back, Dawn, were there things that you remember or that you even hear now that just make it harder to kind of feel like you can access healthcare?
That's a good question. One of my residents, when I first got hurt, I realized that I was in that denial phase I was talking about earlier, and pulled me aside one day and said, "Listen, you're going to see people walk out of this place. You're not going to be one of them. So you need to start getting prepared for it." And I don't know if it was. I think at the time it caught me as a little off, but he was turned out to be right, and it was something I needed to hear probably at the time. It's a little off the topic, but I got really lucky when I got hurt. I was at the U for rehab, and the 1981 National Wheelchair Games was at the U that year, and so I just went straight to having, I'm not just a guy who's going to be. I'd never met a wheelchair person before I got hurt, and all of a sudden there was 1,000 of them at the track. I got super lucky that way. So I know I didn't answer that part of your question very well, but I'm lucky in that regard for sure.
Yeah, connecting to resources is really important.
Yeah.
And Shannon, we talked a little bit about just how important kind of the overwhelming nature and the relatively short stays really pushed you to kind of finding resources on the internet. Can you talk a little bit about that?
Yeah, I guess one of the first things I did, you leave the hospital and you're just kind of in shock, and you go home and you can't do a lot of stuff. So one of the things I spent certainly the first couple months doing is just researching online. And I think I learned more in that period of time than I had in, the month in rehab in some ways. And my therapist definitely connected me to some resources, which was really useful. But just seeing what other people can do, I think that's kind of what you're hinting at as well. And getting a sense of what sort of possibilities are out there was really important to that process of, okay, well, maybe I can figure out how to do this. And I think one of the hardest things is that there is no in-the-box solution that works for everybody. And that's really hard to wrap your head around when, you want to solve the problem, or, you want to figure out, well, what are the things I need to be doing? And they're not always the same for everyone. And so poking around in the internet, there's just so many windows into how different people are figuring out solutions for themselves. And it can be really eye-opening and help you figure out what's going to work for you as well.
In terms of thinking about kind of ongoing healthcare, a couple of you have mentioned kind of that taking the lead and kind of being the expert on yourself. And I think, Shannon, you're talking about that as well, of there's so many ways to do things, and finding your own way and figuring it out, but potentially needing help to do that. What has that experience been like in terms of working with kind of your SCI team versus working with kind of other healthcare providers that may not have a lot of people on their list? So folks that may be out in the community who are physical therapists, occupational therapists that don't have a lot of spinal cord injury experience, primary care doctors who may only see one or two people and don't always know the variety, urology, those other things. Kyle, can you talk a little bit about kind of what that experience has been like? What the people who have done it well, what they do, and the people who don't do it well, what would you recommend that people here don't ever do?
So one example of the ladders, I went to a dentist just prior to my injury, and I'm not the best about getting to the dentist. So, and they're always I feel like dentists are always concerned about canceled appointments more so than other providers. So I felt really bad because I had scheduled an appointment, a follow-up, but I missed it and I didn't call them, because I broke my neck. And
reasonable.
So I made another appointment, and when I went there, I told them beforehand too, because this was, I was concerned. I want to be like, hey, I'm, now in a wheelchair, and that's why I missed the last appointment. I'm sorry. And when I got there, they just treated me in a manner where they were just really nervous, I think. And they ended up not charging me for the appointment and kind of made it a bigger deal than it was. I now am in a wheelchair, and so I ask for certain accommodations. But when they go that far, and it's okay to be uncomfortable. I'm uncomfortable, and I don't expect everyone else to be comfortable. But to not make it an overwhelming big deal, and like 6 people coming into the room and everyone's asking, "Are you okay?" And then actually not even charging me I think they were just trying to be kind. This is every day I'm in this chair every day. I'm asking people to help me, and I try not to make a big deal out of it. So I think having providers to also not make a big deal out of it. And then in terms of doing it well, I think, I think just flip that coin in the other direction, and just try to make it as comfortable for you as possible, and as comfortable, and in that case, it's comfortable for the patient as well.
Len, how about you?
When I released from inpatient, I began my outpatient at an HMO, which doesn't really specialize in spinal cord injury. And the first few months of my outpatient, I was dealing exclusively with that. I completely dropped the connection with Harborview and UW at that point. And it was I made that choice because of what turned out to be a misunderstanding about the insurance coverage I had. I could have stayed with Harborview or UW, but we didn't read or understand the fine print in the policy yet. So I did spend a few months with that HMO, and over time began to realize that this was not getting me connected with resources. A doctor said, well, I saw a need to adjust the foot plate on your wheelchair. So I called Care Medical, which was the company at that time. I left them a voicemail to get on that right away. And I go, Oh, so as we all probably in this room know, it takes a lot more than just leaving a voicemail with paramedical to get that kind of service. So I then began looking around, and I did get a referral to get back to UW, and found out I could have really been going there all along. And also the transitions program, I got back to UW through the transitions program, which the occupational therapist had signed me up for when I left Harborview. But that got me connected again, and I realized it's a world of difference to be where people understand your issues and the resources a person really needs to have to function in this life.
Don, can you share your story about your shoulders?
Sure. Yeah. So being a 36 or so year paraplegic, your shoulders kind of wear out over time. I hurt my right shoulder getting into a Suburban in a hurry, maybe 4 or 5 years ago now. And you know, it was clear right away that I'd done something pretty wrong. I went to a Proliance surgeon guy here in town. He said, "Yep, we're going to do surgery tomorrow, and here are your options for you know, long-term care homes that you can live in while your shoulder heals up." So I went back, you know, a little bit, as you can imagine, stunned by that. And kept figuring, you know, okay, I'm quitting my job, you know, or at least taking a 3-month sabbatical, and it's going to be pretty intrusive. So I went back to the U and looked up through Kathy and other folks that had helped me before, an attending at the Roosevelt Clinic who had done shoulders on paraplegics before and knew that it just doesn't work. Right? You can't keep the thing immobile enough if you cut it all up for it to heal very well. Made plenty of sense to me. So he basically said, if 100 out of 100 times, if you came in walking, I'd do surgery on that thing tomorrow, but I wouldn't do it ever if you rolled in here in a chair. And so I took that, and it works just fine now. I mean, it hurts a little every once in a while, but it's a lot better than I think I would have ended up had I just went with the Proliance thing and done the usual, you've torn up your shoulder, here's the surgery deal. So anyway, so it does help to compartmentalize. You need people who know what a paraplegic is, who know what a quadriplegic is, and who can make decisions based on a lot of interaction with people, I guess. Anyway, that's me.
Shannon, do you want to share your experience as well?
I'm actually going to tell a little story that happened to me the other day, which is more about being out in the community. After we had our conversation, I was out at a bar, a club that my friend had just opened, and I was just hanging out on the dance floor and with some friends of mine. And I probably had 5 or 6 people come up to me and say kind of odd things to me that night. And I understand it was midnight and people were out at the club. But at the end of that, there was one woman who came up to me and she bumped into my legs a little bit, and then she kind of like touched me on the knee to apologize, and she came back over and she said, I'm an occupational therapist, and it is so good to see you out. And it kind of struck me as it had already been a little bit of an overwhelming experience. Like, people had been touching me without asking, and all saying nice things, but it just felt like, in particular, as someone who works in the field, it didn't make me feel particularly welcome. It made me feel like it was extraordinary to be out in the community instead of like it was normal to be out in the community. And I understand that it was meant really positively, but it kind of stayed with me, After that experience, I was like, wow, I was at, this event for like an hour and a half, and 5 to 10 people touched me inappropriately and said really weird things to me. And it doesn't make me want to go back tomorrow. It felt more like other people's experience than my experience. So just a little piece of advice. I think it's cool that woman and everyone else appreciated that I went out that night. But then I also thought to myself, I'm 2.5 years into this. Are people going to be telling me this 37 years later? Oh, they're so glad that I got out in the community today.
Yes.
Dawn, do you get that for showing up for work? Yeah.
Great.
Huh?
So let's talk about that a little bit more, because I think one of the things that I hear that I cringe about, and you all know this because I told you, I cringe when I hear people talking about people with spinal cord injury being heroic or inspirational for showing up for work or showing up for therapy. And I know you all have had that experience. Let's talk about that a little bit, about what that's like when you hear it from anyone at the club versus even from physicians, therapists, or other providers that you might expect. I mean, it sounds like you really expected better of somebody who's in the field. Dawn, do you want to start?
Sure. Yeah, generally speaking, I don't wake up every day feeling different than everybody else. And so there's lots of different ways to remind somebody that they are. Some of them are, like you said, very well intentioned, but it just doesn't work out that way. I guess that's the thing of it. It can come from people at work asking you, for morale events, what would work for you, those sorts of things. On that particular note, right? Pick a morale event. If I want to go, I'll go, even if I can't do the thing. But to have it all based on me just makes you feel too different, right? I don't know if that made any sense or not. But anyway, that's the thing of it for me. I really don't day to day think of myself as being different than everybody else. And 37 years into it, I could use it to not be reminded. Basically, is what it is.
Lan, how about you?
I think exactly that. Early on, I was trying to feel like I was not different than anybody else. And now I'm closer to feeling this is who I am. And so when someone said, "Oh, you inspire me," which was I'm so inspired or so impressed, early on that just kind of, cut a little bit because it brought it all back to me. But as time went on, I just took it to the person really is trying to be thoughtful and trying to say something nice. So it didn't bother me as much. But I realized too there are certain people that will never accept me as being a fully complete human being because of the way they view disability. And so that's a deeper kind of social problem that probably will take some doing to work with. But I noticed these activist groups, Working to Walk and things like that are trying to make inroads and changing the way people think about disabilities. Seems like a good thing.
Kyle, how about you?
I think what you said, it does really resonate with me, where I feel like I'm just trying to survive, and that doesn't feel very heroic.
Shannon, did you want to add anything into that?
I just say that, there's a difference between someone inspiring you because they did something really cool that, you wish you could do. And like you're saying, just surviving because you don't have a choice. And I think that's the thing that it makes you feel like you're different or, maybe admiration is a better word. Like, I admire you for how you handled it, as opposed to inspiration, which is just kind of frustrating, because none of us signed up for this, But people do inspiring things all the time, and that's cool, and we can totally appreciate that. So I think there is a little bit of that frustration there that a lot of us experience with inspiration and also with independence a little bit too.
Absolutely. So I want you all to, I kind of prompted you all to think about this when we all talked, but I want to, before I move to questions from the audience, what advice would you give to healthcare providers, whether it be therapists or physicians or nurses or anyone? What kind of advice, what are the things you want people to think about when working with somebody with a spinal cord injury, whether it be brand new or 30 plus years out? So I don't know who wants to start. Kyle, do you want to start?
Yeah. So thinking about my healthcare voyage, certain people I think of certain people really stand out in my mind. And I was trying to think what unifies those people as being really excellent providers. And it's the ability to both listen and to respond that I think makes a big difference. And as people overall in general, we're not good listeners. And it's hard, when you introduce yourself to someone, often you don't remember their name because you're so focused on, what impression are you making in that small interaction, you're not listening. And when you're a provider, you might meet a dozen or 24 people every day, and it becomes routine. It's hard to truly listen. But both in terms of getting care that felt good to me, and also getting good care in terms of diagnostically, my experience is that the providers who really listened either gained stuff that helped them become better providers, or they were able to be providers that made me feel more human than other providers.
Lan, how about you? What advice?
I believe and remain convinced that most of my healthcare providers have exhibited a sense of caring that sustained me through certainly inpatient, and to this day remains to be the case. And certainly, as Kyle said, listening is a way of conveying that. Also, something I noticed in inpatient and perhaps still in outpatient is that what I want and what I think about my care is important to my healthcare provider, that more so than I remember in my earlier experiences with medical care. I guess maybe that's the philosophy now, to allow the patients to direct more of their care. But that surprised me and seemed to mean a lot to me. And then just to be realistic about and straightforward, and try to be as honest as they can about the future and what to expect down the road. Very helpful.
Don?
Yeah, I've thought about this a lot since we talked, but and I'm going to go maybe a little bit off the rails, but to me, it's the relationship part. Maybe I'm going back to what I was talking about earlier, but people like Kathy and now Dr. Jones that I see at Harborview, I consider them friends of mine. I've known Kathy since I was 17 years old, for God's sake, right? And so it's about going to somebody who you trust, who you've got a relationship with, and that for me, it's the biggest thing for sure. You're never going to get it all right. You're just never gonna. But if you're working with somebody, like I said, you've got a relationship with, it seems to me to make it all kind of work out.
Can you talk a little bit about what those factors are for you? Because, obviously, I think what both Lan and what Kyle were saying in terms of people who listen and who care, is there other pieces about that in terms of that relationship?
I think it's all the stuff that's not about why I tend to go to the doctor when something is acutely wrong. I generally don't go in for a yearly checkup. But when something's wrong, I self-select. I figure out, who's the right person to see with this particular malady, and I go there, right? If that person doesn't understand who I am, it's almost overwhelming for me. I mean, a friend of mine who's pretty heavy. I was complaining about going to a brand new doctor one day and say, I get the same thing all the time. I'll go in with a cough, and the doctor will say it's because you're fat. And he'll say, I've been fat since I was 10, but I've only had this cough for a couple of weeks, right? And that's kind of where I'm at with the wheelchair thing, right? I don't want to explain it's not so much the explaining, but but that's basically it, right?
It's not all about the spinal cord injury.
Yeah, it's about knowing somebody to me. Yeah, thanks.
Shannon?
I think there's two things that come to mind. And the first is, we talked a little bit about, I think someone on this panel might have some better terms for this than I do. But particularly for folks in inpatient, I think there's this balance between painting a hopeful picture of them swinging across their house in monkey bars and painting a realistic picture. And I think it's really important to paint a hopeful picture, but one that has a lot of realism attached. And so finding that balance, I know that when I was an inpatient, it was really frustrating to hear, this might be impossible for you to do right now, but you'll be able to do it someday, And everybody is different, but, when something takes you a year or 2 years or more than 2 years to learn, it is a really long time, and it's really hard to just remain, optimistic every day that you'll be able to do it. So just being able to communicate that balance to people, I think, is really important. And the second thing is, I think particularly with spinal cord injuries, which are always really different and involve, a dramatic change in one's life, and with changing technologies and everything, I think treating it as shared expertise is really important because, I've learned some stuff on the internet and gone to see a doctor and had doctors tell me things that I know are not true. Like stuff I've seen people do or stuff I haven't seen people do. And here I've got a doctor telling me, that'll be impossible for you to do. And I'm like, I've seen it on the internet. Which, don't believe everything you see on the internet. But at the same time, I think there's a lot of things that we learn at forums like this, or we learn from each other, and doctors aren't necessarily learning or hearing about. And so being able to listen to your patients and, hear their experiences and share those experiences with other patients is really important, and lets us, share what we've learned as well along the way.
Can you also talk a little bit, I know you, I don't remember who it was, and you talked about the experience of having someone talk to you about kind of the amount of effort you put in and what that would turn into, and I think it was while you were on inpatient rehab.
I think that was, that was learning how to do some things like put on my shirt, which at the time was really impossible. I really couldn't do it. And now I can do it better myself. But I think, there were a couple instances in inpatient, just that for me, it's really hard just being told, you'll be able to do this someday. I think that was, it made it more frustrating for me, right? I was like, I can't do it right now. And I think that's partly just a communication and a personality thing. But I think it's just a really tough balance, I think, between the sort of vision you have of what you're going to be able to do and that reality. And I don't know if you remember the phrase that I think someone else came up with, or you had said to me.
The hope crusher versus the dream. Oh, I don't remember now.
Was that one of you guys? That was it. It was really good. Sorry that we can't remember it for the panel.
Maybe somebody in the audience remembers it.
Yeah.
The other thing that I just wanted to kind of highlight in what you guys have been saying, and I think we didn't talk about it specifically, is kind of the choice of words that people use. And I'm going to go back to you, Lan, because I think it was with you that we had this. We were talking about just some of the words that they're accurate, but they can be just so crushing. And I think you had mentioned hearing the word like incontinent. And it was early on in your time. Do you remember us talking about that? Just how hard that people have to be careful about how they describe things and what words they use.
Yeah, that was, I think maybe my second day in inpatient, and I'd had an accident, and the attendant was, used that word, and I felt like I was, stabbed. It was just, that's, in my image of what that meant was way in another world of someone that I would ever be. And, that was a bad moment.
Yeah. And I think you've all have described those things of just the words that people choose to use have a lot of power, and being careful about making sure that you have shared understanding and kind of listening. Mm-hmm. So I'd like to now open it up for questions in the audience. Do people have any questions for our panel of experts here? Because I could keep asking questions. Anyone? So I'll start. I think that I'm curious about kind of thinking about different kind of provider groups and thinking about kind of the transition from inpatient to outpatient with for physical therapy. What was the handoff like for you? Because I think one of those things, those transitions are often one of the complexities there. What went well for you guys with those transitions? Because everybody went from inpatient therapies to outpatient therapies. What was the things that helped, the handoffs or the way people prepared you for what to expect next? Because it's very different. Mm-hmm. So Kyle, do you want to start with that one?
I really had an incredible team of family and friends who helped me through that transition. I think that I relied on them more than providers, particularly because I went from Denver, being a hospital in Denver, to doing outpatient here or at Harborview. So just getting those two teams to coordinate, I relied on my partner a lot and my family a lot. So I think, the providers didn't help much in that transition. I think in terms of being prepared for it, they did a pretty decent job at Craig. Mm-hmm. But in terms of bridging that gap, it was just family and friends.
So it might have been helpful to have a little bit more help in that bridge.
Yeah.
How about for you, Lan?
Well, I think I had a gap between inpatient and outpatient. I had a pressure sore from early on when I was in the hospital, and I had a few months where I wasn't really allowed to, go out and get involved in outpatient. But then when I finally did and got connected, by then I was feeling better and much more motivated, and I was eager to start exercising and developing my strength. Plus, my diagnosis had improved. They reclassified my level of injury, and so it seemed like things were moving in the right direction at that point.
How about you, Don?
I was talking about these or with these folks earlier, and back in 1981, they had this deal where they would bring you back, and it was I thought it was great, really. You learn how to go out and or more or less take care of yourself and do the things you think you're going to need to do to be independent, and you got this sort of trial period where you could go off for 3 months, and try it. And then they'd bring you back and sort of brush up for 2 or 3 weeks of like inpatient PT. That was pretty super handy, I thought anyway. Yeah. Anyway, yeah, it was a great way to transition. I think got a little bit of a trial run. Yeah.
How about you, Shannon?
I just build on that and say I think one of the hardest things is you get home and everything's different, because you don't have a million people coming to help take care of you all the time, and you're at your own house, and it's really it's kind of stunning, right? That all of a sudden you have to figure all of these things out at once. That would be really useful if you got to go home for a little while and figure out what you need to figure out, and then go back and learn more. I would say that leaving inpatient and moving to outpatient felt like a really tough transition. And I think it would have been nice to have more support in that. And I think a lot of it is what insurance companies will or will not pay for. So it's not so much the provider's fault. I think that the therapists do a good job of telling you that things will get better, but that's really hard when you're experiencing it. So at least for me, I think that was the hardest part. And then, meeting my primary care doctor, who I'd never met before, she was very nice, but she had no idea what to do with a spinal cord injury. And she wanted to work with me, but mostly that meant saying, okay, whatever you need, I'll do. She didn't have any knowledge really to build off of. And now there's a question in the back.
Well, if there's anything you can provide that helps to us as providers that would be more supportive or more helpful in you being that advocate for yourself, that this is related to your injury versus not, because just as Kyle kind of said, like, you're this person at the dentist before, and now you're like this person that happens to have an injury that makes mobility different, but you're still that same person. And I think it's like providers really expect you to be this new expert that you might not necessarily be. And I, since John's been around a little bit longer with this injury, just if there's anything you can provide or anything as we as providers should help with supporting you to make that call a little bit more, that's something I always kind of think about, because I always try to say, I'm available to a primary care doctor, and you've got one that really understands spinal cord injury, but not all of them do, and not all of them are in Epic, and I can't e-care them or whatever, and I just, whatever anyone can provide would be helpful.
Don, do you want to start?
Yeah, to be honest, I don't know that I have any great insight there. I can give you an example one time where I was frustrated. Maybe you guys can help me understand how I might have done it better. I spent maybe 3 or 4 years chasing around. I used to get these fevers, and they were close to debilitating. My head would pound, and I'd be out of work for a couple of days, and I could never figure it out, the blood tests and all this stuff. And in my head, I hadn't connected fever with spinal cord injury. So I wasn't going to people like Kathy and Dr. Jones. I was going to, the local Virginia Mason guy, right? And what it turned out to be was dysreflexia, right? I just had to pick the right guy, right? I just had to get back to somebody and go, oh yeah, we know what that is. And so, I don't know that I have any insight into how to get that right. Clearly I got it wrong for a couple of years. But I think now I've got, like Dr. Jones was saying, I've got a primary care physician at the UW who knows, who's not brand new to spinal cord injury people. She's not Dr. Jones, but she gets it, and she can, better than I can, sort of triage, is that a spinal cord thing, like dysreflexia, or is that the flu, or is that, some weird, other thing that nobody knows about, right? So anyway, I don't know that I answered any questions there, but
no, I think that's one of the most difficult things, is that balance of how to become an expert in something you're not an expert in yet, but also to balance that out with how do you find the right people to ask those questions of.
Question. I think some of you had spoken to this. I'm just curious because as providers, one of the most anxious periods for us as we discharge people from the inpatient world of rehab is that transition to home, because we know it's tough. From your perspectives, how can we better prepare people for that transition? What would you have liked to have heard? How would you like to have heard that? How early in your hospital course, with their increasingly short lengths of stay, would you have liked to have heard that?
Longer stays.
Who wants to start? Lan, do you want to speak to that first?
The question was, how early did we want to hear what our prognosis?
No, about the transition home. So how soon should we be talking about transition home? What kind of things would you have liked to have in order to prepare? Because it is, as Shannon said, as you guys have all talked about, that's a big, huge transition.
Okay. With 6 weeks, for me, that 6 weeks went really fast, and the goals at the beginning were set pretty high, and in 3 to 4 weeks, I hadn't met the goals, the transfer goals, the physical goals, and so then they started talking about the date I would go home and what the plans would be, and I felt at that point like I hadn't met my goals, and that I somehow needed to meet or come closer to the goals before I could go home. So at some point, I needed to refocus on the goals and have a different view of what it would take to be home. It seems like at about that point, my physiatrist came and told me about, well, yes, they used to have people in inpatient a lot longer, like maybe a year or more. And we read a book about somebody who'd been in inpatient for 2 years, and that sounded, I think the person had been on one side for 1 year and another side for another year. It sounded, well, that doesn't sound good either. So the prospect became daunting when I felt like I hadn't accomplished my goals. I felt like somehow I needed to be much more functional and was not ready. And so somehow there had to be something different about that. I needed to be more ready psychologically than I was. I don't know how that would be accomplished, to tell you the truth.
But something for us to think about. Shannon, how about you? Is there things, you were very clear that was just very overwhelming. Mm-hmm. Are there specific recommendations that you'd give to us to do it maybe a little bit better?
Just thinking about that, and I wonder, one of the things that helped the most for me was meeting other people with spinal cord injuries. So that mentor relationship was really important. And I think it was a couple months after my accident that I went to the first Here and Now meetup, and it's so helpful. I learned so many helpful things there. I wonder if it'd be possible for folks to shadow someone, for a day before they leave the hospital, just to get a sense of, what it really looks like, or maybe make a day in the life of video or something, if someone would be willing to do that. Because it really is that, okay, how am I going to do all of these things? What is my life going to look like? And I think there is a certain psychological element that is just unsurmountable. Just has to be experienced. But I also think that there's some real logistical matters that you really are not sure how you're going to handle, you know. For those of us who need caregivers, that is a whole other thing. It's like running a small business on top of whatever else you do in life. And, you know, being able to, you know, handle that on top of all of the other changes in life is really overwhelming. So, yeah.
Kyle, did you?
Yeah, I think it's important to have those discussions early. And I think having a map is really helpful. So you've got these variables that are unpredictable. Insurance is somewhat one of them. Your progression of recovery is certainly one of them. Any hiccups is another one. So if you have a recovery map and you have you revisit it and reevaluate it as changes occur, so that just so you have as much awareness to that moving target, where it is and how it's moving, and what and goals that still exist before they need to reach before that happens.
That's excellent. Okay, one last quick question.
Lan, at the beginning, you mentioned sort of responsiveness with your wheelchair repairs, and I'm curious to hear from each of you sort of what your expectation for responsiveness and timeliness is, because I think it can really range from different providers, and it might be helpful for people in the crowd to hear like what's a good timeline. And
how quickly do you expect to get a response when you have a problem with equipment?
Or just not equipment,
anything. Timeliness.
Not quickly.
Anyone disagree with it?
I mean, I think one of the things you learn pretty quickly is that everything takes forever. And, you know, I had some parts ordered and I got a call saying, okay, your parts are in. And so I make an appointment and I show up, and in my other wheelchair, so this one can get fixed. And it turns out the parts aren't actually there. They shouldn't have called me and made the appointment. And I hear stories like that all the time from everybody. And then, you know, if I want to change the armrest on my chair and have my insurance pay for it, I have to make an appointment to go see a physical therapist to get a prescription written for my insurance. And, you know, it's just important to know that these things are all going to take a really long time.
And hear that up front. All right, we are out of time. I want to thank you all for joining us today, and please join me in thanking our fabulous panel.
Great job, you guys.
Thank you for listening to the SCI Forum podcast. To learn more or to make a donation, please visit sci.washington.edu.